Yes. Woo. Okay.
Sounds good.
All right. So, hey, you got something in your mouth. What do you got there? Can you say hola? No? Went to sister for protection? Okay. All right, Adriana. So first off, how many weeks pregnant are you?
I am 34 weeks.
34. Okay, very exciting. And what are we working on today?
My lower hips in the back area, kind of later in pregnancy, I start to get tight pain there.
Yes.
Feels a little off and more so. So
Okay,
I'm
30 weeks pregnant.
34.
34 weeks pregnant. I almost forgot about the last 4 weeks, sorry.
I haven't.
And more one-sided on the left side.
Currently on one side as the left, but so this is my third pregnancy, and I felt that chiropractic. Okay, thank you. Chiropractic visits help release kind of the tension and the pain, kind of set things right. I feel like I kind of am off kilter a little bit, but the best
Out
way
of
I can.
balance, is you also use that phrase as well. When it does go down your leg, does it feel like a dull ache going down there, like throbbing, or does it feel like a shooting?
It's more kind of centralized, or in the bum area, if you will.
It's starting to
kind of
centralize.
Stays
Okay,
there.
that's a very good sign. Do you feel weaker on one leg than the other?
No.
How about tighter? Does it feel like if you're stretching, you feel inside tighter?
I feel it more just kind of achy. I kind of just feel off balance and yeah.
Down here and out to here.
Right there.
Okay,
Mhm.
it's the same thing on this side, just not as bad. But that
Correct.
same area, right?
Yes.
Okay. You take a look.
Sure.
Okay, go ahead and stand up.
Okay.
First off, let me do a couple tests here. Go ahead and lean back as far as you can. Does that cause any pain?
No.
Okay, great. Go ahead and go face down on the table. And we should be, I can go up a little higher than that, but there we go. Can you help me check mom, make sure she's okay? No, we're gonna go back to sis? Okay. Next time you'll help me. There's that short right, so that typically, and long right. Did you see that? Which side was longer? You didn't see? Oh, okay. All right. I thought you saw it. I thought you were like, there it is. Okay. Do you feel more pressure on that left side?
Yes. Feels tighter.
Tighter. And immediately as I feel it, it really stands out right there as well. I'm just going to check for some of that weakness though, or restriction. So let me know if this is too much tension on the tummy. You're going to keep this leg straight and you're going to lift it up as high as you can.
There, I feel it. But on
And
the
then
other
it starts
side,
to
yeah.
engage, and you feel it on this side. So that's really important to know. Typically when you lift here and you feel on this side, that's more coming from the low back than the SI joint. Let's go ahead and lift this side as high as you can. I feel a lot less apprehension, like you just dove right in.
Yeah.
No issue. Okay, do you feel anything local in that low back or opposite side?
More on the other front side, more of just a stretching though.
On this side?
On my right side.
Just the stretching. Okay, like it's tight, like it's stretching out that tightness. So you are what's called a positive Deerfield. This is on that right side because you're anterior on the left innominate, but you've gone posterior in the sacrum. So that shearing stress right here, anterior here, posterior here, when it should be right in line like this. So we're gonna move that sacrum forward and pull that innominate back. So let's go ahead and do that.
Okay.
Go ahead and line this side, please, facing me. I'm gonna bring this down for you. There. And right there. Okay. Relax that shoulder. Thank you. Make sure I'm doing a good job, okay? We want to get right on that sacrum. Right there. And relax. And that was beautiful.
Okay.
It's getting easier, I've noticed. Okay, go ahead and switch to the other side. And by helping that innominate on the left roll back, we're going to push the right innominate forward. Okay, sweetie. Can you go give mom a kiss? Go give Mom a kiss. There she is. Okay. Right there. And relax that. Beautiful. Good. Okay, go ahead and lie on your back at the top. We're gonna, when you get that distortion, we want to look at the pubic joint and make sure everything's staying balanced. Okay, flatten your back here. Good. Anchoring the spine, squeeze your knees together. There it goes. Woo. Okay. And that symmetry and that inguinal ligament and the pubic joint is very good. That wasn't like that when you first came in. Okay, now, awesome. Let's have a seat at the bottom.
Need a little help?
Yeah, sorry about that. Okay, can you pull this one up here, sweetie? Can you pull that right there? Nice. Have you thought about becoming a chiropractor? Yeah, you have? Okay. All right, we could use some more help here. Go ahead and interlace your fingers behind your neck and relax your shoulders. Okay, and let this drop this way. We want to open this up. Now it's just ready to release. Very nice. Okay, go ahead and stand up.
Okay.
And I'm just going to have you march in place a little bit. Good, shake it out. All right, allow the body to receive and adapt and acclimate to those changes. Chin up a little higher, take a deep breath. There you go. Go ahead and go face down,
Okay.
and we'll recheck. How did that adjustment feel?
It felt good. I felt
Yeah.
the release, especially on this side.
Oh, yeah.
It's been kind of tight.
Awesome. First thing I notice is that right leg is much longer. Perfect. Can you see that? That's exactly what we want. And it stays perfectly even. Now, be honest. Better, same, or worse?
Better.
Okay. Better, not perfect.
You're better, not perfect, yes.
Okay. Percentage improvement, what would you say?
Oh, I would say at least 70%.
70%.
Yes.
I will take that any day of the week. And then let me just check this guy here. Lift up the left leg high as you can. Good. Okay, and that's beautiful. You're not flaring out your leg this time, so you're isolating the hamstring and glute perfectly. How would you have described that change, though? Again, better, same, or even worse?
It was better, it's easier to lift it.
Yeah.
And I just felt that more of the stretch on the left-hand side as opposed to going
Oh,
across.
hey, that's good. What I would have said same is better, not perfect. I would have said better, not perfect, because you still looked a little apprehensive, but otherwise, that was perfect. So that was great. All right, and we're all set. Come on down.